So many of us have had an episode once or twice in our lives where we've had low back pain. It isn't a fun thing to go through, and not all the time we have the availability to get to another practitioner. So some of these quick movements, stretches, and exercises to do, I personally have dealt with back pain since I was a younger kid, just from things that happen. So these are things that I have kind of compounded together to help myself out when my back does go into a flare-up and I either can't get into the practitioner, I physically can't get into my own car in order to get to a practitioner. So these are things that I like to do first thing in the morning, right when I wake up. I don't get out of bed right away. I do these movements to help either floss the nerves or to create more movement within my discs, to have more blood flow, which helps to bring in more nutrients, because when we're sleeping, things are stagnant. So we want to get more nutrients coming to the area by doing these movements. So first one I like to do is just a quick pelvic tilt. So you're in bed already. So when you're laying on your back, I want you to bring your knees up to about to about a 45 degree. And then all I want you to do is you're going to bring the pelvis up so then the low back goes flat on the bed, and then relax. Bring the pelvic up and relax. Now I do this between 10 and 20 times. So that's number 3. So this is a very minute movement. 4, 5, 6, 7, 8, 9, and 10. So the next thing I like to do is just marches. So I always put my hands on my pelvis, and then I'm going to bring my low back, so it's going to be touching onto the mat or onto the bed, and then I'm going to gently lift up my left leg and my right leg. So sometimes even by doing this, it helps just to kind of shift things in my pelvis, and it kind of brings the SI joint into a movement, into a motion. Again, we're focusing on bringing in nutrients, bringing in some fresh blood to these areas. So I like to do a march for 10 times each leg, just nice small movements. I would also recommend not doing this with a giant heavy weighted blanket on you. So just some slight movements. Then what you're going to do, after you've done about 10, 20 reps of each leg, then you're going to very cautiously, you're going to go onto your side, and your focus is to push up with your arm and not with your back. Then you are going to bring your legs underneath, and we are going to go into a cat-cow, but being cautious not to overextend and overflex our spine. So this is a very light movement that we're going to be doing. So this helps with the nerve flossing we were talking about earlier. So this light movement. So I would do this again between 10 and 20 times each rep. Being cautious to focus on your breathing as well. And then lastly, we're going to stay in this position, and we're going to be going into a very beginners of a bird dog. So a typical bird dog is going to be opposite arm, opposite leg lifted. But instead of that, we are just going to kind of bring our front hand and drag it along the mat, and you're going to bring the opposite leg, not off the mat though, not off the bed. I want you to keep it on there. And then you're just going to bring it back. This is a very steady movement, and we're going to go the opposite leg. You're just going to drag it along and then bring it back. Drag it along. And bring it back. So for this, again, I like to do 10 to 20 reps, depends on kind of the stage that I'm in. And I do these exercises at least 3 times a day. That is my main goal. When things start feeling better, that doesn't mean that you stop doing them. You have to maintain doing these exercises and keeping your back healthy. So these are fantastic things to do until you find that time to get to a practitioner. So if you are in this new acute phase of a back injury, a back flare-up, try out these exercises. I find that they help me out.